Good afternoon, fellow Floridians. Welcome back to Healthy Practices. I am your host, Chris Sarah, a registered nurse working right here in downtown O-Town. If you are new to our show, I'd like to say thank you for joining us. We're glad you're here. Don't forget to like and subscribe. On today's episode, we're going to be talking about chronic kidney disease, also known as CKD. More specifically, we're going to discuss how hematocrit levels can be affected when the kidneys aren't functioning properly. If you or someone you know has anemia related to chronic kidney disease, or if you just wanted to learn more about an illness that affects 1 in 7 Americans, then you don't want to miss today's show. Grab a cup of coffee, sit back, and let's get started. To better understand chronic kidney disease, let's quickly review healthy kidneys. What does the renal system do all day? Kidneys filter the blood and excrete the waste, kind of like a little sieve. They balance acid-base levels, regulate fluid volume, and they play a main role in regulating our blood pressure. Kidneys maintain homeostasis by balancing electrolytes, and they can secrete a hormone called erythropoietin. Let's focus in on this hormone for just a minute. Erythropoietin travels through the blood and signals the red bone marrow to make reticulocytes, which in 2 days' time will mature into erythrocytes, otherwise known as red blood cells. So what is so important about red blood cells? Why did we go from talking about chronic kidney disease to zeroing in on erythrocytes? Well, I'm glad you asked. RBCs are like little Ubers transporting oxygen and carbon dioxide to their appropriate destinations. They provide tissues with the O2 necessary to function. Erythrocytes are critical to survival, and a severe deficiency of erythrocytes can be fatal because of the lack of oxygen. The number of RBCs within the blood is determined during a lab test called a complete blood count. So is the percentage of your blood that's made up of RBCs. This value is called your hematocrit. An adult's normal hematocrit level should be anywhere between 36 and 52%, depending on the person's gender. A critically and chronically low hematocrit level is associated with many complications, including a prolonged bleeding time, though the relationship is not yet fully understood. Hoffman and Sullivan state that anemia occurs when there are fewer RBCs. So anemic patients have less vehicles to transport the oxygen molecules. This explains why they would present with shortness of breath, fatigue, and pale skin. Treatment for anemia secondary to chronic kidney disease may include erythropoietin-stimulating agents, such as Procrit injections. Basically, this is a way to provide or supplement the hormone necessary for stimulating erythropoiesis. Iron supplements or iron-rich foods may be recommended, and in critical situations, a blood transfusion may be ordered. Patients with CKD should avoid elements that may cause further damage to their kidneys. Common nephrotoxic agents include NSAIDs, like Advil, loop diuretics, contrast dyes, and some antibiotics. There is no cure for CKD, but you can change modifiable risk factors to slow the progression of the disease. We've said it here before and we'll say it again. The key to a happy, healthy body is a proper diet, regular exercise, plenty of water, and above all else, talk to your doctor about how you can stop smoking today. Take care of your body and your body will take care of you. That's all we have time for today here, folks. Thanks again for joining us. I'm Chris Zara, and I look forward to discussing more healthy practices with you next week. Bye-bye, and be well.